5 warning signs of silent fatty liver disease. What if I told you that an estimated 1 in 4 adults in the United States is walking around with a ticking time bomb inside their bodies and they have absolutely no idea? Some global estimates are even higher, approaching 1/3 of the population. It's a silent condition, a quiet epidemic that often shows no symptoms at all until the damage is severe. The problem is the early clues are there, but they're incredibly easy to brush off as just part of a busy modern life. In this video, we're uncovering the 5 subtle warning signs of fatty liver disease your body might be sending you right now. Signs it's crucial to spot before it's too late. Recognizing them is your first step to diffusing that time bomb and reclaiming your health. In this video, we will review the verifiable pathology of this disease, discuss the recent name changes, and focus on the 5 subtle clues your body provides that demand a conversation with your physician. The liver is the body's largest internal organ and is central to metabolism. Its malfunction can send indirect, often subtle signals throughout the body that are easily missed. This condition is deeply tied to our modern metabolic health, things like our weight, blood sugar, and cholesterol. This condition is an epidemic that has been quietly growing for decades, requiring a recent change in its official medical terminology to better reflect its true cause. Its prevalence and severity demand immediate attention from both the public and the medical community. Welcome, or welcome back if you're returning. I'm Dr. John Chuback, board-certified general surgeon and cardiovascular surgeon. Today we're tackling a health crisis that's been quietly growing for decades. It's called steatotic liver disease, or more specifically, metabolic dysfunction-associated steatotic liver disease, MASLD. For years, we called it non-alcoholic fatty liver disease, NAFLD, but the name was updated to better reflect its true cause, its deeper connection to metabolic health, including our weight, blood sugar, and cholesterol levels. So what is it? Simply put, it's a buildup of excess fat in your liver. Think of your liver as the body's main processing plant. It's a powerhouse that filters toxins, helps the digestion, and manages your energy. A healthy liver should have very little fat. But you've crossed the line into fatty liver disease when more than 5% of your liver's weight is fat. Now, this happens in stages. The first stage is simple steatosis, or just fatty liver. At this point, there's extra fat, but not always significant inflammation or damage. Many people have this and don't know it. But if it's left unchecked, the condition can worsen. When the fat buildup triggers chronic inflammation, the condition advances to a more serious stage called steatohepatitis, which is now termed MASH, metabolic dysfunction-associated steatohepatitis. This is where your liver cells start to get injured and damaged, akin to a slow, smoldering fire. From there, the path can get even more dangerous. That persistent inflammation leads to scarring, a process called fibrosis. If the scarring becomes widespread and severe, it leads to the final irreversible stage, cirrhosis. Cirrhosis dramatically increases your risk of liver failure and liver cancer, and that's a destination we want to avoid at all costs. The journey from a fatty liver to cirrhosis can take years, even decades, but for some people it's much faster. The scariest part, the whole process can happen while you feel completely normal, which is why we have to learn to listen to the body's quietest whispers. So, how do you spot silent disease? You have to pay attention to the subtle, indirect clues that are the 5 signs that demand your attention. The first warning sign, and maybe the most common and easily dismissed, is a deep, persistent fatigue. This isn't the normal tiredness you feel after a long day or a rough night's sleep. This is a draining exhaustion that doesn't seem to improve even with rest. You might just feel off, like you're constantly on the verge of getting sick. So why does this happen? Your liver is a central player in your body's energy production. It converts food into usable energy and stores it for when you need it. When your liver is clogged with fat and battling inflammation, its ability to manage energy is seriously impaired. It's like trying to run a city on a power plant that's only at half capacity. The flow of energy slows down, and the buildup of toxins a healthy liver would normally clear can make you feel even more sluggish and exhausted. This kind of fatigue is especially common in people who are overweight or have a condition like type 2 diabetes, which are at major risk for factors like fatty liver disease. If you're feeling bone tired for no obvious reason, don't just write it off. It could be your liver crying out for help. The second sign to watch for is a nagging discomfort, a dull ache, or even a feeling of fullness in the upper right part of your abdomen, what we call the right upper quadrant. This is right below the ribs, exactly where your liver is. Many people mistake this for indigestion, a pulled muscle, or just gas. It's often not sharp, stabbing pain, but a constant low-level awareness that something isn't right in that area. What's causing it? As fat builds up, your liver can physically swell and become inflamed and stretched. Unlike other organs, the liver itself has few nerve endings, but it is surrounded by a delicate membrane called Glissen's capsule, which is full of nerve endings. It's this stretching and pressure from the enlarged liver that creates that sensation of pain or fullness. This symptom is particularly common if you are obese or have gained weight quickly. Your enlarged liver is literally running out of room. If you often notice a strange pressure or ache in the upper portion of the right side of your abdomen, your belly, it's a significant clue that deserves a conversation with your doctor. This next sign might seem backward, especially since fatty liver disease is so closely linked to being overweight. But unexplained or unintentional weight loss can be a warning sign that the disease is progressing to a more advanced stage, typically fibrosis or cirrhosis. This often comes with a noticeable loss of appetite. You just don't feel hungry and start losing weight without even trying. The reason for this is rooted in the liver's declining function. A damaged liver struggles to produce bile, which is essential for digesting fats and absorbing nutrients. A sick liver can also disrupt the delicate balance of hormones that control your appetite and metabolism. Your body is essentially entering a state of malnutrition, even if you're eating. The weakness and loss of appetite are signals that your body just isn't getting the fuel it needs. While some people might welcome unexpected weight loss, if it's happening without changes to your diet or exercise, it should be treated as a serious red flag that liver damage may be advancing. The fourth sign is one of the most classic and alarming indicators of serious liver trouble: jaundice. This is when the whites of your eyes and your skin take on a yellowish tint. It's an unmistakable sign that the liver is failing to do one of its most critical jobs. Jaundice happens because of a buildup of a yellow substance called bilirubin. Bilirubin is a waste product made when old red blood cells break down. A healthy liver processes bilirubin and sends it out of the body in your stool. But when the liver is severely damaged by advanced fibrosis or cirrhosis, it can't filter bilirubin effectively. This yellow pigment builds up in the blood and gets deposited in the skin and eyes, causing that yellow color. Jaundice is not an early sign. It means that fatty liver disease has likely progressed to a much more severe stage where significant damage has already happened. If you or someone you know notices any yellowing, it's a medical issue that needs immediate attention. The fifth and final warning sign is a noticeable change in the color of your urine and stool. Specifically, your urine might become unusually dark brown, amber, or cola-colored, while your stools become pale and clay-colored or even gray. These two symptoms are directly linked to the same problem that causes jaundice: the liver's inability to properly process bilirubin and make bile. The dark urine is caused by your kidneys trying to get rid of the excess bilirubin that the liver failed to clear from the blood. The pale stools, on the other hand, are the result of a lack of bilirubin reaching your intestines. Bilirubin is what gives stool its normal brown color. When the flow of bile from the liver is blocked by damage and scarring, the stool loses its pigment and turns pale. Like jaundice, these changes are not early-stage symptoms. They are serious signs that your liver is in significant distress and that you need to get medical attention right away. Now that you know the signs, it's just as important to know if you fall into a high-risk group. As the new terminology MASLD implies, fatty liver disease is overwhelmingly driven by metabolic factors. You're at a significantly higher risk if you are overweight or obese, especially with excess visceral fat located around your belly, what we call abdominal obesity. If you have type 2 diabetes or are diagnosed with insulin resistance, if you have high blood pressure, hypertension, or have dyslipidemia, which means high levels of cholesterol or triglycerides in your blood. Additionally, if you have what's known as metabolic syndrome, which is a cluster of 3 or more of the above conditions. Another risk factor is if you're middle-aged or older, as risk generally increases with age. Another risk factor would be if you have a family history of liver disease or certain genetic factors like a variation in the PNPLA3 gene. If you recognize any of these risk factors in yourself, you should proactively speak to your doctor about screening. Recognizing these signs is your first line of defense. Remember, this video is for educational purposes only and is not a substitute for medical advice, diagnosis, or treatment. If any of these signs, the deep fatigue, abdominal ache, unexplained weight loss, or changes in your skin or bathroom habits sound familiar, especially if you have the risk factors we discussed, please make an appointment with your certified physician. They can run simple tests like a liver enzyme test, examine you properly, and use non-invasive imaging such as an ultrasound or specialized ultrasound called FibroScan to assess the amount of fat or scarring in your liver. The most important message I can leave you with is one of hope. In its early stages, simple fatty liver disease, steatosis, is often completely reversible. By making positive lifestyle changes, improving your diet, getting more physical activity, and achieving sustainable weight loss, you can significantly reduce the fat in your liver, calm down the inflammation, and stop it from progressing to more serious damage. Learn to listen to its whispers so you never have to hear it scream. Stay informed, stay proactive, and take control of your liver health today. I'm Dr. John Chuback. Thanks for your attention, and I will see you in my next video.